We continue with our series about development and what to track with your children as they grow older. We saw already our first 2 months of age. I am going to talk today about what is expected when the child is from 4 months of age. We know that by 3 months of age, the child should be smiling at you. You should observe how your child is able to calm himself or herself. Self-soothing should start in a more consistent way around 3 months of age. The child will be looking at you when you are talking to your kiddo. Also, your child should be making cooing sounds. They should be making gargling sounds. And your child, very important, should be turning his head towards sounds. He will be looking at the sound source and he will give a body response. It could be movement, it could be cooing, it could be a smile. Your child around 3 months of age is already paying attention to your face and also is following you with his eyes. If a child that is 3 months old is not following or more tuning to the environment, that will be a red flag and that will be a concern you should raise with your physician in your appointments. Your child around 3 months of age should have better head control. That means they will hold their head stronger, and if you place the child on their bellies, they should be lifting their head and starting to push up from surfaces when they are on their bellies. About 4 months of age, the child will smile, especially at people. You will talk to your child, the child will smile back at you, and the child also will start kind of setting in that play of cooing if you are giving attention, or cooing if you are not giving attention at all. They start seeking for undivided attention. Also, around 4 months of age, your child should start bubbling. All that bubbling sound is very important, and also your child will start having facial expressions to sounds. From the cognitive standpoint, 4 months of age is very important. In this period, your child will start reaching for toys with one hand. The child will be bringing the toy to his mouth. The child should be exploring toys with his mouth, and he is starting to recognize familiar faces and to respond more consistently to his familiar environment. From the movement standpoint, a child will hold his head really on midline. You pick up your baby and your baby's head should be right straight up on midline, and when you place your baby on his belly, your baby will lift the head up all the way and will start using his hands to push his chest off surfaces. This is very important in order to learn how to roll, which is going to come up around 5 months of old. And also, when they are on their belly, if you place them on their elbows, they will just stay up there, content, looking at things, looking at their environment. They will turn their head to the right, to the left. They will be way more engaged with the environment. Things that you need to check for that should be a concern for you to take to the pediatrician. When your child doesn't look at things as they move. If something moves in front of the child and the child is not following, yes, talk to the pediatrician about it. When the child is not smiling at you when you are talking or interacting with your child. When your child is not holding his head steady, or when your child is on his belly and is not pushing up. I'm talking about 4 months of age. And also, if your child is 4 months old and if your child is not bringing toys to his mouth, that is a significant concern you need to bring up with your doctors. Also, if your child is having difficulties with his eye tracking, is not perfect, but his eyes should be moving in both directions. If your child's eyes just move in one direction and is not quite right when they move their eyes in the other direction, that is a significant concern you need to show to the doctor, because those are signs of immaturity. And the description of the ages, I broke them down in more detail, because if you wait till the child is 6 years or 6 months, oh, I'm sorry, 6 months old, the child is going to miss a lot of those little details I'm talking to you about, that could be taken care of when it is right to take care of. So we are going to prevent further delays.